Hey there, it's time to take the lead. Trust your voice, know what you need. Let's break it down.
Welcome to Beyond Clinical Walls with your host, Dr. Bayo.
Claim your life.
Picture this. You're the one everyone counts on, the caretaker, the problem solver, the strong one. You ignore the headaches, brush off the fatigue, and keep pushing through. Then one day, your blood pressure is scary high, your body is screaming, and you can't pour from an empty cup. Today's guest turned that wake up call into a mission to help people survive and thrive. If you're new here and you landed on this episode, I'm Dr. Bayo, your health advocate and a board certified family medicine physician. I bring the work I do as a doctor with me on the news, on social media, and here on this podcast. By the end of this episode, you'll be able to recognize the warning signs that stress is damaging your body, understand exactly what to ask your doctor about medications and your health, and walk away with practical framework you can start using today, no matter how busy you are or how tight your budget is. Today, I'm excited to be joined by Dr. Alisha Reed, a board certified geriatric pharmacist and self care strategist. She counseled patients about managing their health until the day her own blood pressure reached 180/110, and she was widowed at age 40. Dr. Alisha became the patient she had been counseling for years. As a single mother managing high blood pressure, anxiety, PTSD, and sleep apnea, she has developed a practical framework that teaches people not only how to prioritize wellness, but also a strategic self care survival mode. She now hosts the podcast Your Self Care Prescription, serves as board chair of the American Heart Association, and is a passionate advocate for heart health. Dr. Alisha, welcome to the show.
Well, thank you for having me.
Well, thank you for joining me. So, I always like to kick off the show with a rapid fire question. Are you game for that?
Yes, I
Okay.
am.
All right. So the first one, which is, a heavy question, coffee or tea, and how do you take it?
So, coffee, and most people will be surprised. I do like black coffee. However, I've been adding collagen peptides in it.
All right. All
Yeah,
right.
so
I'm going to
a little
ask a little
fancy.
bit. Okay. I'll ask a little bit about, and I like black coffee as well, but maybe I'm going to have to try this
Yeah.
collagen peptide. I like it. Your, your go-to stress relief when you only have 5 minutes.
It's deep breathing and a quick walk.
Okay. If you could make everyone understand one thing about how stress affects your health, what would it be?
That stress is not just in your head. Like, it's in your blood pressure, it's in your heart, it's in your entire body, not just your head.
I like that. A lot of times people are very surprised to know that it is embedded into every single thing
Yeah.
from our head to our toes. Your favorite self care strategy you are teaching your child?
We talk about rest is not lazy. So just knowing that it is okay to take breaks, to have boundaries, and just relax and do nothing sometimes.
I'm going to take that to the bank. I'm going to take that with my
You too?
kiddo too. That's
Yes.
good to know. That's a great gem to drop. All right. The one question you wish every person would ask their doctor or pharmacist.
I think they should ask, what should I look for or watch for with this medication? A lot of people don't ask that question.
Many of our listeners right now are probably driving, cleaning, or doing some sort of multitasking. What can we all do for the next 30 seconds to decrease our stress levels and be more present in the moment?
I would say to take some deep breaths. We are so tense. Relax your shoulders and clench your jaw. It's an amazing stress reliever.
And it's something you can do
Deep,
anywhere.
yes. Because we forget, like, we're so uptight sometimes, and you're like, oh, let me just relax my shoulders and
Right.
clench my
Yeah.
jaw.
And I'm like, Am I getting oxygen in? Because sometimes you're so stressed, you're like,
Yeah,
you forget to
yes,
take that deep breath.
yes,
Oh,
yes.
that's incredible. Yeah, I love that. Okay. So this is great. I feel already more centered. I think, right now that's what I'm going to take a deep breath in.
Yes.
I'm going to roll my shoulders back and we are going to get into this conversation that everyone came for. So I shared a bit about your story in the intro, but I want to give you space to just tell it in your own words. Take us back to the moment when your blood pressure reached 180/110. What was going through your mind? And how did it feel to suddenly be on the other side of the conversation that you've been having for patients for years and still do?
Yeah, it was my husband passed, had been about 6 months, and, of course, dealing with grief. At that time, the world had shut down because of the COVID pandemic. That this was in 2019, into 2020, and I just noticed that I just wasn't feeling well. I had headaches, but I assumed that it was all grief related because I wasn't sleeping, and I was just thinking that this was just my way of grieving. And I decided to take my blood pressure. I have a blood pressure monitor at home, and it was surprisingly high, 180 over 110 with medication. So, I take medication. I've been diagnosed with high blood pressure for a long time, and it's just that I didn't know that it was that high. And I counsel patients about it all the time. And just to realize it and just see that, and it brought me back to a question my 4-year-old asked me shortly after my husband passed. He asked me if I was gonna die too. And it was more of like, you wanna answer that question truthfully, right? So, of course, but you know that at will eventually die, right? But I had to answer it with, I will do my best to stay alive as long as I can. And in that moment, I was thinking like, with a blood pressure of 180 over 110, that's serious. And I needed to figure out a way to better manage my blood pressure with not just medication alone.
Well, first, I want to honor your story and the passing of your husband. So, sending condolences in this moment. And also highlight like how many different things happened in that space. Not only you're in a grieving, you're grieving and you're still grieving. That's something
Yeah,
that I
yeah,
feel
right.
never has an
Right,
expiration
right,
date. And then you have this number that can be alarming, that could also make you your blood pressure
right,
higher. And then you've got your child who's asking you a question that I think any parent, anybody who is taking care of a little person, that's like a dagger to the heart. Like,
yes,
are you
yes,
going to, so all of those things combined can be really, really difficult to take in and then try to figure out what are the next steps, as you mentioned, to take care of yourself, to make sure that you will do everything you can to
right,
be there. So that leads me into the question when we talk about the stress that happens to our bodies. I personally am always telling patients, "Y- let's see what we can do. Let's figure out how we can manage all the things that are happening in your life, which can feel overwhelming in itself. So, help our listeners understand the connection between grief, stress, everyday life, and what is happening to our bodies when that's occurring.
well, the first thing we talk about is, I know a lot of people hear about like fight or flight, right? How your body's in fight or flight. When you are stressed or chronically stressed, you're in survival mode, right? And your body is working overtime and you're thinking about it's producing cortisol and you have inflammation. So it's essentially everything going on in your body is really like it's working against it, right? So if you have high blood pressure, the stress is causing your blood pressure to raise. You may lose sleep. It's affecting every part of your body, which can ultimately lead to other issues. It may affect your kidneys. And it wouldn't just be your heart, it's other areas of your body.
I'm glad that you mentioned the kidneys because I often hear that, oh, high blood pressure, the heart, we talk about the heart. That's the biggest thing.
Yeah.
But I'm like, the kidneys too. If
Yes.
the kidneys are stressed, we know then you have dialysis. There's a lot of
Right.
things. And that's the regulator, first of all, of blood pressure. So you want to think about the stress and how it impacts all of the organs. What are some of the warning signs that everybody should know and not ignore when it comes to high blood pressure?
The number one thing is most people don't realize that high blood pressure is called the silent killer, right? Because oftentimes we don't realize that these are symptoms or that our blood pressure is high. But you may notice that in terms of stress that you're having trouble sleeping, teeth grinding, like constant fatigue, irritability, and tension, a lot of tension in your shoulders. And I know there's a lot of talk going around. Perimenopause is the hot topic right now. And a lot of people aren't realizing that it could also be your blood pressure.
Here's a reality check. According to the American Heart Association, cardiovascular disease kills more than all forms of cancer combined. And yet, only 44% of women recognize that cardiovascular disease is the greatest health threat. And stress is one of the biggest contributors. Dr. Alicia, why do you think so many people don't take that connection between stress and physical health seriously until something major happens?
I think people feel like stress is normal. We have normalized stress and like hustle culture and believe that if we take breaks, we're lazy and we're not working hard enough. So I really do think that is ignored because it's treated as being overworked, overwhelmed. That's all the norm now. And I also think it's because you can't really see it, in terms of like, let's say you are exercising and you sprain your ankle. That requires you to take rest, to stay off your
Mhm.
ankle. But in terms of stress, it's like not something that you can see or you really don't feel the full of blown effects of it until it's too late.
And that's why blood pressure and not always feeling it, even though it's high. And when it's too late, people will crash.
It's because stress feels normal. I think we've normalized being overwhelmed, overworked, and exhausted. We wear it as a badge of honor. And we think if we can't see it, it's not real, right? High blood pressure doesn't hurt, so we don't think about it. It doesn't show up like, let's say if we're exercising and we sprain our ankle or do something, pull a muscle. It doesn't feel like that. So we don't treat it that way.
I feel like it's a badge of honor to
Mhm.
say, I have not slept. I have worked 18
Yeah,
hours and I'm just going to keep pushing
right.
through. And instead of, I got 18 hours of
Yeah,
sleep. This is lovely. There's no like
right.
excitement or, wow, I'm so glad that you took care of yourself by getting 18 hours of sleep. There's such a discrepancy between the
Yeah.
two.
Yeah, and it's like we feel like we have to earn it, right? We have to earn our rest. So like we have to do all these things and then we can take a break. But yeah, I think about it like your car, right? So you get your car and you'll get your car serviced whenever something comes, the light comes on, you bring it in. But with our bodies, we just keep pushing. We just
And
keep pushing. No matter how many signs, the warning signs go off, we just keep pushing.
I've had patients share with me that they noticed that they were having blurred vision, or they noticed that they were just more tired than usual, which
Yeah.
were those warning signs. And it wasn't until they ended up in the hospital or something happened for them to recognize it. And that's where, when we talk about knowing our body best, you got to know when you need to rest,
Right.
when you need to tune up and make sure that you're taking care of yourself. Which brings to light the whole self-care myths that we hear about, where people think it's that expensive yoga. And we talked about the real things, real practical things that you could do. Can you give examples of things that people can do even right now as they're driving in their
Yeah.
car to invest in themselves?
Yeah. Real self-care isn't about bubble baths and spa days, although I love those. Like,
Yeah.
don't get me wrong, I love a spa day, a nice bubble bath, but real self-care looks like going to therapy, even when it's hard, taking your medication every single day, setting boundaries with people who drain you, saying no when you need to, asking for help. That's a big one. A lot of people don't realize asking for help is really a form of self-care because you're allowing someone else to help you. Sleeping 7 to 8 hours, getting that proper rest, and then moving your body even when you don't feel like it.
Self care and therapy. That is powerful.
Yeah.
Celebrating that, like,
Yeah.
that is a huge thing to connect the dots, because it's normally I have a crisis or I have something else. No, that is a form of self care. And I think everybody listening right now is going to reframe that in their mind. So, that leads me to refill strategy. I want to talk about it. I want to learn more. Tell me where that came from, the drive to put together a strategy that people can actually use.
Yeah. So I thought about my knowledge. I'm a pharmacist. I know all about cardiovascular health and the medications, but I felt like it wasn't just the knowledge alone wasn't keeping my blood pressure down. And I like to say like we know better, but you have to do better, right? You know better, but you have to do better. So I needed to figure out a way that I could create some type of system. In school, we had all the mnemonics and all the acronyms. You're thinking like, okay, what can I come up with to really like keep me going and really serve as a checklist to make sure that I'm doing all the things that I should be doing to take care of myself that I know I should be doing, but how can I put this together so that it's easier for me and actionable? I realized that it was 6 things. Being a pharmacist, I was like, refill. So I thought about like refill. We always talk about that's the number one question that we asked all the time. Can I get a refill? Or do I have any refills left? So I said, rest often, exercise daily, fuel your body, invest in self care, love yourself, and live intentionally. And that's a framework. It's a daily checklist, my survival strategy. Of course, it's not perfect. It's working. And that's what matters. And I know that those are the things that keep me going. And that's something that I can incorporate into my everyday life. It's not something extra, it's something that can fit into my everyday routine.
I know that's why I gravitated to it so much because it is something
Yeah.
practical that you can, all right, I can do this. I can it's not too long, it's not too short,
Yeah.
and I can do it every single day. And even
Day.
if you only do one out of the entire word, that's something you've
Yeah.
done.
Yeah. And you also think about it in terms of, I'm a healthcare professional and I'm a patient, right? So you think about it's not until you're in that patient those patient shoes that you understand all the things that I'm telling this patient to do during this visit. Are they really grasping it? Are they really gonna go home and do all of these things that are written on this paper? What is something easy that they can remember? And that's refill. And it's all of the elements that you would essentially counsel a patient about when managing their chronic conditions.
Imagine if a healthcare took what you just shared
Yeah.
and poured that into every aspect of health. My goodness. Because it's all about getting the information in
Yeah.
and then making sure it happens, but it
Right.
can be overwhelming. And to your point, when you have your patient in front of you and you're all of the things that they're supposed to remember, they may not feel well. They're
Yeah.
like, I don't even know why I have this prescription.
Right.
And what am I supposed to do? And so just to be able to have this checklist that helps people be like, okay, I can do that. Speaking of being a patient and a clinical health professional. Every day that I'm in the clinic, I am so grateful for the pharmacist that I get to work with or call. Let me just tell you, I you have such a wealth of knowledge and I know you know this, but I still want to celebrate it in a way that I I'm very grateful because you've helped catch errors that have happened. You help connect the dots when there's something that I didn't know a specialist ordered and I'm ordering a medication. You're like, oh, no, no, we got to fix that and change that. And I want the audience to know that because sometimes there's this thought, oh, they're filling a prescription. No, you're doing more than that. You are
Yeah.
saving lives to make sure that nothing happens. And you're a great resource. I personally know when I have a complex patient and I'm like, I was thinking this medication, but I was also thinking about this medication. Do you have any ideas? And the conversation that comes
Yeah.
from that is beautiful. So, for two of us in healthcare, there's a topic that is something that I've been advocating for change. And I would love to have your take on that. And that is when it comes to blood pressure and Black people. There is this algorithm, this recommendation that if you are Black, that you should be on 2 classes of hypertensive medications, calcium channel blockers and thiazides. What is your take on that?
Right. So when you talk about the algorithms, yeah, and I know a lot of people that's what you're taught in school, right? But you have to look at the actual patient. I think providers often focus so much on the guidelines that they lose focus of the person sitting in front of them and really thinking about what medication will work best for them, not just based on what a guideline may say that me- probably doesn't even have the evidence or it hasn't been proven to be most effective like patients, right? Being able to offer them all of the available options to better manage their blood pressure, and then also understand that making adjustments and finding what works for them it's all a part of patient-centered care, right? Making sure that the patient is taken care of as a whole and not just looking at the guidelines. Guidelines are helpful, but you also wanna make sure that you are taking care of that patient that's sitting across from you who may not present exactly like the guideline.
And being prescriptive in the care that we deliver
Yeah,
and making sure that it's based on that person, not the color of their skin,
right,
because that data is not actually supported anymore.
right.
And so I'm glad that we could, highlight that because I see patients all the time and they're like, I was told to take this because I'm black. And I'm like, no, that shouldn't have happened
Right,
first and foremost, because the studies have shown that race-based prescribing is actually harmful. It should be about the person in front of you and what medication
yes.
is the right choice. Now, when it comes to budgets, because everyone's on a tight budget, and if they've got like a budget of maybe $20 extra to spend, how do they maximize that discretionary income of $20 to invest in their self care?
One of the tips that I like to share with patients, particularly patients that have like the flexible spending accounts, right? So if you have the flexible spending accounts available to you, utilize that for some of your self care purchases. A lot of people don't realize that you can purchase fitness trackers, you can purchase blood pressure monitors, you can purchase sunscreen. There's acne skincare. All of those things are covered. Massage appointments, massage therapy, acupuncture. So that's one of the hidden gems that I like to share because you may be able to offset or alleviate some of those out of pocket costs right then and there with your flexible spending account. Also, don't forget about the things that are free. Walking outside is free. I know there's a joke when people say outside is really expensive. Yeah, it depends on what you do, but taking advantage of if the weather's nice, being able to take a walk, breathing exercises. We have a lot of YouTube videos of yoga, meditation, things that you can utilize at home. Setting boundaries is free, sleeping is free. So those are a lot of things that you don't even have to spend money for. However, like if you do have a budget and you have money set aside, one of the things that I like, honestly, is I get subscription boxes like the skincare subscription boxes, and you get like products every month. And it's like a way to treat myself to sometimes it's skincare, hair care, perfume. So that's an easy way to get some things like to treat myself every month. And also looking at therapy apps, journals. So those are things that are actually affordable that people don't think about as self-care.
The anticipatory piece, I got so excited when you talked about it
Yeah.
with the subscription boxes. First of all, I get excited when it's coming. I'm
Yeah.
like, yeah, what's going
Yeah.
to be in there? And then you get to try things that you have never
Right.
tried. And let's talk about the muscle that flexes, the brain.
Yeah.
When you are challenged with new things that are coming, new products, reading new things, trying new things, all of those are also good for your overall health as well, which can reduce your
Yeah.
stress.
Yeah. Yeah. So I think there's just a lot of things that people overlook because they're so focused on self-care being so expensive.
As a pharmacist, you understand medications in a way most people don't. So let's get really practical. If someone is sitting in their doctor's office and their doctor is prescribing a medication, even a blood pressure medication, what questions do you recommend they ask about? Walk me through the top 2 to 3 questions.
The first question, and a lot of people are scared to ask this, but I would ask, is this the best medication for me? Like, is this medication the best medication for me? And like, give the doctor the opportunity to explain why they've decided to choose this medication for you, for your treatment. Then also ask them about, like, what's the goal that I'm trying to reach? What's my treatment goal? Because there are often times where people will not even know, like, how do I know it's working? Right. So that's an important question. And then also maybe asking them about if there's anything that they should avoid, like any other medications. But I will say that's something that's usually deferred to the pharmacist. So those top two questions would be like, is this the best one for me? And then what should I be looking for? Like what is the goal with this medication?
I often share how when you see your doctor, there is this level of vulnerability that happens. I equate it to you're in and all of a sudden you have all this information. You may be very educated on what you want to say and then you walk in and you're like it's just evaporated
Yeah,
because
yeah.
there's this power dynamic that happens in that room and leading with the two questions of is this the best one? And what is my goal? I love that. I often share with patients, I'm like, ask what are the next steps? So if this medication works or doesn't work, what should I expect? So that's a lovely way to not only get the information that you should have anyway, but arm yourself with what challenges could possibly happen and if they happen, what to do because you understand medications in a way that most people will never be able to understand. And I mean that because you just know the nitty gritty. If someone is sitting in their doctor's office and they are confused because they went to their pharmacist, they picked up their medication, they feel like things haven't gotten better, they're back in front of you. And then the doctor, which we know happens, pitches them back to you again and say, well, ask your pharmacist for more of these questions. What is something that that person could do with their pharmacist to get more information about what they're taking or their overall health?
The pharmacist is an excellent resource. I would say ask the questions. You want to know, is there a specific time that I should take this medication? Is there something that I should avoid while taking this medication? A lot of people do not realize that there are food interactions, food and drug, not just drug and drug interactions, but there are food and drug interactions. So asking, is there anything I should avoid? And then also asking what side effects are normal. Like, there are some things that you may experience while taking a medication that go away with time as your body adjusts, but then there are some other things that may occur that are not normal, and asking a pharmacist about that is truly helpful.
The pharmacist is an underutilized. See, I'm your like hyper. It's an
Yes, yes.
underutilized resource. You guys are fantastic. I'm like, it's something that people don't realize. I'm like, you have so much knowledge, you have so much information, and you're the one that often will hear about, oh, this happened with this medication
Yeah.
or the having this challenge. And so I just want to, encourage everybody to make a connection, a relationship with your pharmacist. If you could give everyone three takeaways from this conversation, the three things that they can remember and act on, what would they be?
First, I want to be clear and say, medication isn't always enough. You need a system. You need something that works alongside the medication, and I know we talk about that a lot with patients, and we say, yes, you can take this medication, but there are other things that you need to do along with the medication. So I think that that's important. Recognizing that self-care is not selfish, it is survival. The last thing would be just start where you are. Don't try to overcomplicate it. Don't try to tackle this big self-care routine, but, do small steps and that along the way adds up. Like one boundary counts, one therapy session counts. You don't have to be perfect. You just have to start.
Now, I said that was like the two to three key takeaways, but now that leads to one more question I have. We are going to check ourselves and be more in tune with our blood pressure and take those small steps. When should we expect, especially if we start the refill strategy, when should we expect to notice some improvements or that we're making strides?
You most definitely will feel it before you see it, right? So I would say within 2 weeks, you should notice like better sleep, lower stress levels, more energy because you are taking that time to prioritize yourself. And then we know when we are managing chronic conditions, it usually takes about 4 to 6 weeks for you to start seeing, your numbers coming down or, really being able to gauge the goal, how close you are to goal. And then I would absolutely say within 90 days, you should be able to see measurable changes in your sleep quality, your blood pressure management, stress management. And it's important to track. That's another thing that I like to make sure people understand. You want to make sure you're tracking so that you're able to see the benefits of the work that you're doing. And then also readjusting if something is not working.
The word readjusting is a good thing for everybody to like put in their pocket
Yes.
because sometimes we feel like we're like we have to keep doing this, keep
Yes.
doing this. But no,
Yes.
there's no harm in readjusting when needed. If anything, it's a way of being more in tune to what you need in that moment because it's not a one size fits all and
No.
it's not always the same. Sometimes minute by minute, day by day,
Yeah.
all of our
Yes.
lives change. So I love that. I'm so grateful for this conversation. Thank you for
Thank
sharing your
you.
purpose with us and for giving people permission to prioritize themselves without guilt. For those who want to learn more about Dr. Alicia and dive deeper into the refill strategy, you can follow her on Instagram at Dr. Alicia Reed and listen to her podcast, Your Self Care Prescription. Dr. Alicia also has a strategic self care starter kit to help you implement what we talked about today. We'll have all the links in our show notes. Any final thoughts?
I just want women to recognize that our health is a priority. And if this is the permission you were waiting for to take care of yourself, this is it.
I love that. Did something in this episode click for you? Share it with someone in your life who needs to hear this. Remember, you can't pour from an empty cup, and taking care of yourself isn't optional. Your health depends on it. You've got this. Thanks for listening to Beyond Clinical Walls. If you learned something new today, please leave us a review on Apple Podcasts or Spotify. It really helps us reach more people who could benefit from these insights too. Hit subscribe so you never miss an episode. We've got amazing content coming, including great episodes with the health creators you love.
You've heard the truth, now take the lead. Stand for yourself, know what you need. One step closer, you've made your mark. Keep showing up and light the spark.